And joining us now is Denis Nash. He's a distinguished professor of epidemiology for the City University of New York's School of Public Health. He's also the executive director of CUNY's Institute for Implementation Science in Population Health. Professor Nash and his team launched a large-scale COVID-19 research study following the onset of the pandemic. And thanks again for being here. Professor, what can we learn about the virus and the pandemic in your report titled Chasing COVID?
Well, we launched that cohort back in March of 2020 because we sensed the pandemic could have a significant impact beyond New York City and potentially for a long time. So understanding the virus's impact on individuals, households, and communities, not just its direct impact, but the socioeconomic impact and psychosocial impact of the pandemic and its response were important priorities for us. And we've learned a lot about the epidemiology of the virus, about the impact of the pandemic on psychosocial and economic outcomes like common mental disorders and food insecurity. And most recently, for example, we're learning a lot about how people's COVID testing practices have changed, with more people COVID testing exclusively at home or not testing at all, with health insurance now being a barrier for that.
You mentioned
both of these things undermine the ability to detect surges when they happen.
Absolutely. And you mentioned mental health. We're about to enter Mental Health Awareness Month in May. What did you learn about that specifically in the report?
We've learned that the prevalence of common mental disorders like anxiety and depression are much higher during the pandemic than they were at a national level in 2019, and that they are persisting for much longer than they typically do. And in the community where people have less access to healthcare during a pandemic or in general, it's harder for them to get the services they need, the medications they need to help manage it. And all the while, the various traumatic things that happen, losing loved ones, becoming seriously ill, losing jobs, these have had significant impacts on people's mental health.
An FDA official said this week vaccines for children 6 months and older might become available in the U.S. as soon as June. Why has the authorization of COVID-19 doses for young kids taken this long?
Well, I think the safety and efficacy and the right dose and dosing schedules are really some things that take a while to establish, especially in kids. Their bodies span a range of different sizes and their immune systems are in various stages of development. So the optimal dose and interval can be hard to pinpoint. And if you don't nail it the first time out, you kind of need to try different approaches. And it may vary a lot by age.
You're currently joining us from Philadelphia, where last week officials removed a citywide mask mandate for public indoor spaces just days after reinstating it. How does that policy reversal, you think, affect public health? Does it affect public health?
Well, I think we just need to always remember that we're still very much under the threat of this pandemic, including due to surges and future variants. And our health officials will need to make challenging calls and in the face of less reliable data and less timely epidemiological information about what the pandemic's doing. So we need to get used to the idea of restrictions coming and going until we can really comfortably feel that we're on the other side of this in a more endemic phase. But I sympathize with these health officials. They're working blind sometimes, and there's a lot at stake.
I want to get your take on Dr. Fauci's decision not to attend Saturday's White House Correspondents' Dinner due to concerns about COVID-19. How do you feel about that decision and big picture, large unmasked indoor gatherings taking place as the pandemic continues, even if everyone in attendance has been vaccinated and tested negative, as it will reportedly be the case for today's event?
Right. Those are good steps, of course. I mean, we know these gatherings are happening a lot these days. They often result in cases and super spreading. And I think it's going to become even more common when community transmission increases, such as during a surge. But they're also within the guidelines that the CDC has provided for this phase of the pandemic. And it leaves it up to individuals to decide if it's wise or not for them to attend, given their risk profile and that of their contacts. But I think what's unique about this gathering is that, the president has decided to attend. And while he's also following CDC guidelines and making a decision based on his personal situation, In the case of President Biden, there really could be, he does need to be able to fulfill his role of leading the nation and has additional special considerations in that role. So if he gets COVID, there could be larger consequences than those to his own health that I think are need to be considered here.
Fully noted. Thank you so much, Professor Denis Nash, for joining us today.
Thanks for having me.